Okay, so today we are covering the appendicular skeleton. If you review table 8.2 on page 97, it's covering all the just the names of the structures or the definitions of the structure that we're going to be talking about, and it's really helpful to have an idea of what you're looking for because they're going to have some unfamiliar names, but if you kind of have an understanding about how or what those words mean, it makes a lot more sense. So we're going to be covering 126 bones today. There's 206 on average in the adult body. Obviously, it's you start off with a lot more, and as you age, actually, as you get older, they fuse, and you can end up with fewer. Okay, so we're going to be covering the pectoral girdle, the upper limbs, the pelvic girdle, and the lower limbs today. And there are two main bones that make up the pectoral girdle, the clavicle and the scapula. And I want you guys, if once we we'll go through the basic structures on this stuff, but I posted some videos on YouTube that that you should be able to access through the NAU shell, and you can use those as a guide to help figure out these structures, but when you get into lab is really when you're going to learn some of this stuff or really hammer it down, I guess. So the clavicle has three structures on it: the sternal end, the acromial end, and the conoid tubercle. So the sternal end is going to face medially towards the sternum. The acromial end attaches to a structure on the scapula called the acromion, right? And the conoid tubercle is a little cone-like projection. Tubercle is kind of a bump that sticks off. So when you, those are really just the three structures that you need to be aware of. Right? And the clavicle is one of the most commonly broken bones in the body, right? And so typically you don't see something as severe as shown in these x-rays. It's usually a simple fracture. You don't really see the kind of destruction that's shown here. And the reason it's the most commonly broken bone in the body is because it's really one of the main attachment points for the upper limbs to the axial skeleton or to your core, right? So if you fall and you break your fall, you're going to put your hands out. All that force is transmitted to this little bone, the clavicle, and so it's really interesting about the design. It's kind of has this bow-like shape, and it breaks away from your internal organs, right? So it's going to break out versus kind of break in, where you could rupture your lungs or something, your heart or something like that. So it's kind of interesting to think about how the shape and the design of these bones serve certain functions, right? And so the clavicle, one of the functions is kind of to attach or stabilize the upper limbs to the axial skeleton. Okay, so the other bone in the pectoral girdle is the scapula. There's 14 structures on this that you need to be aware of, but they're really grouped into just a couple categories, which makes it a lot easier. All right, so the categories are: you have two processes. A process is a projection, the coracoid and the acromion. Right, so the coracoid, if you look at the root of that word, cora means crow. The crows, the family name is corvids, so it has a beak-like. You're going to see that root pop up a lot whenever you see something that looks like a beak or kind of a sharp projection or sharp process. Often has the name or the root cora. The other process is the acromion, and if you break that word down, like acrophobia means fear of heights, the acromion is going to be the highest point or the highest process on the scapula. It's probably the easiest way to figure out which process is which. And then you have a bunch of threes. You have three borders: a superior, lateral, medial; three angles: a superior, lateral, and inferior; and three fossas: superior, infraspinous, and subscapular fossas, right? So if you see the names, so supraspinous, infraspinous, those things are referencing the spine, obviously. And so the spine, which you haven't talked about, is the structure along the posterior side that you can see on the lower image, is is really, you can kind of think of it as a wing on your scapula. You can feel it often if you kind of manipulate your back and your general kind of right below your traps. You should be able to feel that spine, and then a lot of things are based off of that. So those three fossas in particular, so the supraspinous, the infraspinous, and the subscapular fossa. Then you have a scapular notch. The glenoid cavity is where the humerus articulates with the scapula, and then again the aforementioned spine. All right, so far we've talked about the pectoral girdle, so the clavicle and the scapula, and now we're going to get into the bones of the arm. Again, what I want you guys to do is look at those YouTube videos, and when you come to class, you should be able to generally work your way through some of the bones. All right, so for the humerus, there's 12 structures, and one thing we're going to highlight, particularly in class, is figuring out left or right. And so the YouTube videos, again, are really good at kind of detailing it, so I won't go into it in too much detail now, just because it's difficult from a 2D image. It's much easier once you actually have the models in your hand. So just some of the structures that you need to be aware of on the humerus. There's 6 on the proximal end, so the one that's closer to that glenoid cavity on the scapula, right? Because that's the point of attachment, and that's what proximal means, closer to the point of attachment. And so you have a head, 2 necks, an anatomical and a surgical. And so whenever you see the term anatomical neck, that's really just referencing the base of the head. The kind of, you see like where there's areas that covered in cartilage or areas of articulation, and usually just below that you'll see the anatomical neck. And then 2 tubercles, right? And so if you remember that a tubercle is a bump, and whenever you see the words greater and lesser in anatomy, it's referencing larger and smaller. So greaters are bigger, lesser is smaller. So you have a greater and lesser tubercle, and then they are separated by intertubercular groove. And then the last structure on the proximal end is the deltoid tuberosity. Tuberosity is a rough patch or a rough area, and it serves as like a attachment point for muscles. So if you imagine that you are scoring or roughing up the surface of a bone just so you can make that attachment better. And for this one, the deltoid tuberosity, as you might have guessed, is an attachment point for the deltoid muscle. Okay, if you look on the distal end, you have, we'll start with the condyles. And the condyles here, a condyle is kind of a knuckle or something that sticks out, and it's usually associated with articulation. So you see it in joints. And the condyles of the humerus have 2 special names, the trochlea and the capitulum. Right, so the trochlea is the medial condyle, and the way that I remember that is Mr. T, in the sense that MT, medial condyle, trochlea. All right, so the medial condyle is the trochlea, and trochlea is basically a pulley, and that's what it means. And if you look at the elbow, right, so which is where that area is, where the trochlea is located, you're really forming a pulley system. And then the lateral condyle is the capitulum, which basically means little head. And so LC, who was a character on The Hills, is the way that I remember it, but lateral condyle capitulum. So LC, MT, medial trochlea, lateral capitulum. Then you have 2 structures on top of that. They're called epicondyles. You have a medial epicondyle and a lateral epicondyle. Epi, like epidermis, means on or above. And so for epicondyles, you have, or they're going to be located above or on top of the condyles. Right? And then 2 fossas, we have a coronoid fossa and a olecranon fossa. Right? So that's different than coracoid. Coronoid, again, is going to be, a fossa is a depression or an insertion, or it literally means to dig. Right? So, or it's like trench. And so a fossa is going to usually receive some sort of projection. And when we get to the ulna, we'll see that there's an olecranon process and a coronoid process, and those things are going to articulate with those fossas. Okay, so for the bones of the antebrachium, anti means before, brachium means arm or branch, so it's the forearm. There are 2 bones in there, the ulna and the radius. And we're going to start with the ulna. It's the medial bone in the forearm, and there's 6 structures that you need to be aware of. 4 on the proximal end, right? So we already talked about the coronoid process and the olecranon process. The coronoid is going to have that beak-like projection, right? So if you look at that root, coro, cora, it's going to be referencing beak-like or bird-like. And then olecranon, if you look at the root of that word, ola means elbow and chronon means head, like cranium. And so you're looking at the head of the elbow, and if you look at where it's located, the olecranon process, or just called the olecranon, is located at the kind of the proximal portion of the ulna, right? And so those things are going to articulate, and with the trochlea and the capitulum, and so those things are going to form up that pulley system, right? And so if you look at the trochlea, here we have the trochlear notch, right? So this is the area that's going to articulate with the trochlea or the medial condyle on the humerus. And the last structure is the radial notch, and the radial notch of the ulna articulates with the radius, right? And so if you look at it, when you see those bones, you'll actually see a notch, a very smooth groove that the head of the radius articulates or can pivot in. And on the distal end, two structures. The head of the ulna is actually located on the distal, and in the way that you can remember that is that distal ulnar head, or DUH, it's very atypical that it's located distally, but again, you're just referencing it as the head of the ulna. You don't need to distinguish it as the distal end. Just know that it's located distally. And then the last structure is going to be the styloid process of the ulna. And you need to be pretty specific here just because there are a bunch of styloid process. If you look at the root of that word, it's like stylus for Nintendo DS. It's a little pointy projection, a pen-like projection, a stylus-like projection that shoots off of the ulna. Okay, and the radius, pretty straightforward here. There's 3 structures that you need to know. The head of the radius is located proximal. That's what articulates with the radial notch. You have a radial tuberosity. Again, a tuberosity is a rough patch, and that's going to be an area for muscle attachment. And then you have the styloid process of the radius. And if you actually look at feel your wrist, right? Just below your wrist are these styloid processes, and these are these bumps, those bumps that stick out. Right? So if you actually feel that kind of knob that's out there, right? Depending if you're medial, if it's medial, it's going to be the ulna. If it's lateral, it's the radius, right? And so it's kind of cool to think that, oh, those bumps are actually not part of the wrist. They're making a house around my wrist, kind of protecting those little smaller wrist bones. All right, so we're going to tackle, we just did the arm, we did the humerus, the radius, and the ulna. Now we're going to do the bones of the wrist and the hand. All right, and so here we have the carpals, metacarpals, and phalanges. So you don't need to know any specific structures on the carpals, just the 8 bones that are composed, that compose the carpals. All right, and so we usually start with the proximal row and work our way from the thumb, so lateral to medial, and then we go to the distal row and go lateral to medial. All right, so here we're looking at the right anterior hand, and what we have is scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. And there's a couple of mnemonic devices that you can use. One that is pretty easy to remember is some levers try positions that they can handle. And the beginning of each one of those words is the beginning of the bone, right? So the first letter of the bone. And if you look at it, you have scaphoid or some, right? Some under the thumb. Scaphoid, lovers is lunate, triquetrum, positions, pisiform. The pisiform just is, PC means P, so it's a little P-like bone that sits on in your carpals. Then trapezium, that, trapezoid, they, and if you look at I comes before O, so trapezium comes before trapezoid. Capitate, it's the capital, the middle. It kind of goes to the third metacarpal, which goes to your third phalanx, which is your middle finger. Right? So capitate is in the middle, and then hamate, handle. All right, so there's a little structure on there called the hamulus of hamate, or the hammer of hamate. It's kind of, it looks similar to the pisiform, but the pisiform is a separate bone. That hamate just has a structure on top of it. All right, and so those are the 8 carpal bones. Here's another image detailing it through, looking at posterior and anterior views. And again, you can work your way through scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. All right, so get familiar. You should be able to identify all 8. Metacarpals. Meta basically means above. And so here you have the bones that are above the wrist, or above the carpals. And there are 5 bones. They're numbered 1 through 5. All right, and 1 starts with the thumb. So it goes 1, 2, 3, 4, 5, ending on your pinky. 5 metacarpals. The phalanges, right? So these are your fingers, right? So the metacarpals basically make up the palm of your hand. The phalanges are the fingers. Singular, it's phalanx. And that root is soldier, so phalanx in the Roman times were soldiers that kind of lined up very neatly in rows and reminded those guys of, so your fingers reminded them of little soldiers. All right, and so pretty straightforward. You're going to have 1, 2, 3, 4, 5 again, with the proximal phalanx being your thumb, or excuse me, proximal phalanx 1 and distal phalanx 1 composing your thumb. The one thing to note about that is that all the other fingers 2 through 5 don't have, or excuse me, have a middle phalanx, while your thumb does not. Right? And your thumb also has a special name called the pollex, and we'll see that pop up when we get into muscles. The opponent's pollicus, or pollicis, depending on where you learn it, both are kind of readily heard, is a muscle that opposes the thumb, right? So you wonder where that root is. I mean, it's kind of all these things. Your big toe has a similar one. When we get to the feet, we'll talk about that. But the thumb has a special name called the pollex. It's also missing the middle phalanx. All right, so that's the upper body. Now we're going to get into the lower body. The pelvic girdle has 17 structures. You see them called ossa coxa or os coxa, and we'll get into again how to figure out left and right and some of the details in lab. But just generally, you should be able to start realizing and start thinking about the structures and the bones that are composed of this. All right, so the 3 bones that are actually fused to make up each os coxa are the ilium, the ischium, and the pubis. All right, and so there's 10 structures on the ilium that you need to know. There's the iliac crest, like the crest of a wave. Iliac fossa, right? Remember, fossa is a depression or kind of a cup in some sense. And then you actually have 4 iliac spines, and a spine is going to be the sharp little point that sticks off of the ilium. You have an anterior superior iliac spine, an anterior inferior iliac spine, posterior superior iliac spine, and posterior inferior iliac spine, right? So, you know, that's why it's important, and we'll talk about it in a little bit more detail, figuring out anterior or left or right, and anterior and posterior, because it's really crucial in terms of identifying those appropriately. And don't give abbreviations for those. It's just, you know, sometimes in other classes they accept AS, IS, but what we're looking for is anterior superior iliac spine. All right, and then you have 2 sciatic notches, greater and lesser. Remember that greater is bigger, lesser is smaller, and then they're going to be separated by what's called the ischial spine, or the spine of ischium. That's actually on a separate, considered part of a separate bone, but you know, for right now it doesn't really matter. And then the last 2 structures are the acetabulum, which is this cup-like structure that the head of the femur sits into. So it's actually forming your hip joint. And you're like, why is it called the acetabulum? Usually areas of action or interest get special names. So things that are weird or do weird things, or really interesting, or you hurt a lot, tend to get weird names. And your hip joint is pretty high action, so it gets a special name called the acetabulum. And so if you look at the root of that, where that comes from is acetic acid. And so it's a little cup that they used to store vinegar in, reminded the Greeks and Romans of or the hip, that structure on your hip where the femur sits in, reminded them of this vinegar cup. And so acetic acid, acetabulum, that's where that word kind of gets its funkiness from. All right, and the last structure is the sacroiliac joint. This is where the sacrum, or the base of the spine, sits in and joins with the hips. Right, so that's another kind of important structure, but it's we really talk about it a little bit more detail when we get to the axial skeleton. So just know that the sacroiliac joint is where the sacrum hits the ilium. All right, 3 parts of the ischium. The ischial tuberosity, remember the tuberosity is a rough patch, and it's kind of your butt bone, your sit bone. And then we already talked about the ischial spine. And then the last structure is that big hole in the middle called the obturator foramen. Foramen means hole. You'll see that pop up, especially when we get to the skull, just because we have a lot of holes in our head. And obturator, that means like obtuse or kind of hidden. And so the obturator foramen is actually this hole that's hidden by a bunch of tendon sheaths and muscles and ligaments. So it's kind of hard to see it. So it gets that name, obturator foramen, or hidden hole. Okay, then the pubis. Not too much you need to know about it besides the pubic symphysis. Right, this is the point in the most anterior portion of the hip where it's a piece of fibrocartilage where the 2 pubic bones connect. Right, and so in women during pregnancy or right before childbirth, their body will secrete hormones that start to break down or loosen that fibrocartilage and allow it to stretch and really accommodate a child. And so that's one of the features that the body has evolved to do, or one of the characteristics that allows childbirth to kind of happen with fewer hitches. All right, and so we'll talk about some of these details a little bit more in class, but it's a little easier to see. Just a couple things right off the bat. If you're trying to tell the difference between a female and male pelvis, a couple things you can look at is what we call the flare of the hip bones, or the flare of the ilium. Right? So if you look at the iliac fossa in a female versus a male, the female is going to be much wider, and that's again to accommodate the weight of a child in there. Right? So male pelvises are much narrower. The male coccyx tends to face more anterior. So the coccyx is a little extension off of the sacrum. Right? You can see the sacrum with 8 holes right there. Right at the bottom of it is a little tail, your tailbone really, and that's going to face more anterior in males. A couple other features: the greater sciatic notch is going to be more angular in males, and so it's going to look kind of like a triangle and less rounded, which is what you see in females. And the same thing holds true for the obturator foramen. So you can see the obturator foramen is kind of hidden right now. It's kind of got a sheath in front of it, but those holes in the males are going to be more angular. And the same thing with what they call the pubic angle, which is formed right below the pubic symphysis. It's going to be, in males, it's going to be less than 90 degrees or less, and females, it's going to be much wider. So those are a couple features that you can use to identify male and female. Right? So with males, generally, you're dealing more angular, more upright. Yeah, and so with females, again, you're flared out, more circular, just generally less angular. Okay, so the bones of the lower limbs. We're going to cover the femur, the tibia, the fibula, and then the bones of the feet. So in the femur, there's just a couple basic structures that you need to be aware of. So the fovea capitis is the hole in the head of the femur, right? So fovea capitis, again, the root means head. Fovea, the root means hole. So it's this little hole on the head of the femur. It actually has a structure called a round ligament that articulates or connects to the acetabulum. And that's how you help keep that femur locked in there. All right, and so again, you're going to have the neck right at the base of the head. You have a greater and lesser trochanter. Again, greater means larger, lesser means smaller. Trochanter means wheel. And so these are your wheels of how you get around. and you have a bigger and smaller one. And then in between the two, you have an intertrochanteric crest. Again, that's going to be posterior, and it's just going to be a ridge that connects the two trochanters. As you work your way down, you have a linea aspera, or literally a rough line that runs the posterior length of the femur. And then you have two condyles, a medial and lateral. These guys don't have special names like you see in the humerus. If you remember that the medial condyle in the humerus is called the trochlea, the lateral condyle in the humerus is called the capitulum. These don't have special names. They're just medial and lateral condyles, and then medial and lateral epicondyles, so little bumps or little knuckles above the condyle. Right? And then in between the two, you have an intercondylar fossa. This kind of a fossa, again, is depression, and it sits in between the two condyles. For the tibia, just a few major structures here that you need to be aware of. Again, there's two condyles, medial and lateral. You also have a medial malleolus. So the tibia is the medial bone in your leg, right? So this is your shin bone. You can feel it. You can actually feel, they call the anterior crest. It's that sharp angular ridge that kind of that runs the length of the tibia, right? And so that sharp edge is your tibia, right? And so that's the main weight-bearing bone in your lower leg. And at the base of it, kind of where the styloid processes were on the ulna and the radius, you have a medial malleolus. So this is like the ulna's styloid process, and you can feel it, right? So if you wonk on your medial malleolus, you bang your ankle, you're actually hitting your ankle, you're hitting this tibia, right? This structure on the tibia that's making a house for your ankle bones, right? And the only other structure here is the tibial tuberosity. Again, it's a rough patch at the proximal end of the tibia. All right, so the fibula, this is a little difficult to kind of get a grasp of figuring out left or right. Again, we'll hit this a little heavier in class, but the structures that you should be aware of are the head, where it articulates with the head of the tibia, and then you have the lateral malleolus, which is going to be the lateral bump, right, that goes with the medial malleolus. So kind of those things that you tend to hit on sides of stuff. All right, so we've talked about the femur, the tibia, and the fibula. We're going to hit up the tarsals, the metatarsals, and the phalanges. And there's a lot of overlap here with the hand. The difference is that with the tarsals, right, so tarsals are your ankles versus the carpals, which are your wrists. You only have 7 tarsals versus the 8 carpals. And the 7 tarsal bones that you have are the calcaneus, the talus, the navicular, the medial, intermediate, and lateral cuneiform, and then the cuboid. And one of the mnemonic devices that I like is clever tigers need MILC. Clearly that's not how you spell milk, but it just kind of rolls off the tongue, I feel. And you can always come up with your own or Google search any of them. But we're going to start kind of with the back portion, so that tuberosity of the calcaneus, so the calcaneus is your heel. Then you go talus, navicular, right? So this is kind of like the sphenoid, in a sense, of your foot, right? So they both have this kind of similar curved lima bean shape. They're actually rooted in the nautical terms. Sphenoid, the root is boat or kind of canoe, and navicular is kind of a navy, so that aquatic boat type thing. And you kind of look at it, it kind of looks like a canoe, and it has that lima bean shape to it. Anyway, you have the calcaneus, the talus, the navicular. Then you have the medial, intermediate, and lateral cuneiforms. And then the cuboid, which is a cube-like bone at your pinky. All right, so again, calcaneus, talus, navicular, medial, intermediate, lateral cuneiforms, and then the cuboid. Metatarsals serve the same purpose, or have the same numbering as you see in the metacarpals. The metatarsals 1 through 5. These are going to make up the meat of your foot, everything but the toes, right? And say with your toes, again, these are called phalanges. Individual ones are called phalanx, and they're going to be numbered 1, 2, 3, 4, 5, starting with the big toe. So starting medial is 1, and then going to the pinky, which is 5. they're all going to have a proximal, middle, and distal phalanx, with the exception of your big toe, which does not have a middle phalanx. So proximal phalanx, middle phalanx, distal phalanx start with 2 and go through 4. Or excuse me, 2 and go through 5. Right? And so 1 does not have that middle phalanx. It also has a special name called the hallux, which we'll see pop up when we start talking about muscles. All right, and so the goal eventually is to get you guys, whatever track you may go on, particularly it's in the medical field, you're going to be looking at x-rays, right? And so you should be able to eventually feel comfortable knowing what the calcaneus looks like, and okay, what happened, what's a fracture of the calcaneus going to look like? And so, as you kind of keep this stuff in mind, you need to get familiar. We're just taking the first couple steps to get you to that root or get you to that end point. But again, keep thinking, okay, how do these things fit together? What do they look like? What should I expect to see?